Dr. Aditi Nerurkar now, a physician at Harvard Medical School. So many things to talk about today, Doc. I want to start with the big news that starting September 20th, that week, booster shots are going to be available for Americans. Just your take on what we heard from the federal health leaders today.
You know, Aaron, I was frankly very surprised that it's a blanket statement saying all those over 18 should get the booster. I was anticipating something a little bit more stepwise. Older adults, those with comorbid conditions, frontline healthcare workers, and of course, immunocompromised people. So this is a big surprise and a departure from what we were anticipating. And I also worry about the psychology of this messaging. When we say that we need boosters for all over age 18. I want people to be sure to understand that waning immunity is not zero immunity. You are protected with 2 shots. And for those who've gotten their shot early on in the course, 8 months ago, they may require a 3rd booster.
We are seeing some instances, data showing that there are cases where people who are vaccinated are getting sick more than previously thought. More people are getting sick than we previously thought. Help us understand what's going on in the body that allows a vaccinated person to still get COVID. And would you expect to see more of these cases in folks who maybe, for example, were vaccinated back in December?
Yeah, Aaron. So there's 2 main factors that are going on here. The first is the Delta variant, and the second could be a waning immunity. Many of the people that you're mentioning, 75% of breakthrough infections occur in people over the age of 65 and with immunocompromised conditions. They were also the groups that most likely got the vaccines very early in the course at that 8-month mark. So what we're seeing is a twofold, the Delta variant in addition to the waning immunity, hence the need for boosters for this particular group to prevent the further breakthrough infections in this large population.
All right, we will have to leave it there for today. We appreciate your perspective and helping us learn a little bit more about what's happening here. Dr. Aditi Nerurkar, thank you.
Thanks, Aaron.